understanding trauma the first 4 hours. So what do you think, if you have an injury, okay, and you have an acute injury, meaning that it's something that just happened, what do you think you can do on your own before you even start talking to us to try and treat that injury?
Stop doing what you're doing.
Stop doing what you're doing, ice it. Yep, anything else?
Motrin. Try self-diagnose. Is it a pulled muscle or is it something that cracked? Kind of like figure out what's really going on in your head. You feel it, so you can kind of diagnose yourself a little bit.
Yes, I've got some reservations with some of that, right? But just because here's the thing, is when people hurt themselves, you guys should all be aware of this. When people hurt themselves, your mind goes immediately to what?
The worst.
Worst case scenario, right? Immediately goes to the worst case scenario. And so what happens is you start to emotionally kind of invest in that idea that it's the worst case scenario, okay? And so you are now looking for validation of that, right? And so with everything that happens, every little tweak that you feel, everything that hurts, that's a confirmation of what you've already escalated to in your head, okay? That's why it's so important that you reach out to us and let us talk to you and talk you through what happened and what's going on, because oftentimes what we're doing is we're kind of talking you off a ledge, like, hey, listen, you know, the chances that your foot is broken from you stepping off of that step or whatever is pretty low. Let's treat it as if that's not the case, and here's what you can expect, right? Most of the time, it is not that worst case scenario. Here's a good thing to remember, okay? Common injuries happen commonly, right? And rare injuries happen rarely, okay? So the most common thing that you're gonna see is probably what happened, okay? So just keep that in mind. Call us if you're starting to, you know, emotionally invest in what's